The payment system for rural health clinics is outdated, and we do know how much it costs us to see a patient because we are required to do a cost report for Medicare every year, and the end of that cost report tells us how much money it costs us to see each patient.
I know our rate of reimbursement is so much lower in multiple areas because Doug has told me what he sees at some of these FQ clinics, how much they get reimbursed for Medicare visits and private insurance even. I mean, our rate of reimbursement is so low.
Without the RHC designation, we would have closed a long time ago. For us out here, and for especially having a nurse practitioner-owned clinic, I think if we tried to do it as a straight Medicare facility and we'd lose 20% right off the top and not have the extra reimbursement from Medicaid, there's no way we could be financially sound out here in the sticks.
We don't get any local support. We don't get any state support. All we get is the grant money from projects that we take on and the payments from payers or patients. That's it. We have done some grant things that have required additional work for us as well, but they're all good things that have improved quality health care and also improved the health of some of our patients.
Working with Doug is good. It's very good. He has huge visions and he is a dreamer. He is a visionary. He pushes forward. He uses what he can. He finds resources, like I can't believe. Sometimes we get a little too involved with all these different projects, but they're all for our patients. Like he wants to make this a better clinic.
To be really honest, the finances in most rural communities for the hospital are really challenged right now. It's a very different picture if you are in a ski resort community where you have a different payer mix and certainly probably very different property taxes too to feed a mill levy. In most rural communities right now, the hospitals are really challenged and they're living on, if they're lucky, a 1 to 3% margin every year, but most honestly are working on a negative margin. And that's very concerning because rural healthcare is so important. When you have a payer mix in our community that is about 85% Medicare, Medicaid. Therefore, it became challenging for clinics and independent practitioners to continue to make a living and to remain viable and to reinvest in their clinic supplies, hiring, those kind of things. We recognize that at the hospital, and of course our main goal is to make sure that we are providing access to quality care. And we felt like the best decision was to bring multiple clinics under the umbrella of the hospital to provide them with greater support, whether that's from the standpoint of HR, marketing, recruiting, providing additional capital to invest in ultrasound machines in the clinic or just being able to hire staff. So really it was a decision that was related to continuing the viability of our healthcare system throughout the county that we serve.
Tell me about the history of the decision to move towards rural health clinic status.
So the decision is multifaceted, and certainly there's financial benefits for us, but more importantly, I think it helps us move down that path of care coordination and integrated care, which I truly believe is the future, whether we're talking about providing for the community or we're talking about doing our part to drive down the cost of healthcare. So the RHC status for us is a catalyst to move us in the right direction for the future healthcare delivery system. And certainly there are financial benefits, and anything you can do to maximize that Medicaid reimbursement, it just helps us to remain viable and continue services.
We are working towards getting all of our primary care clinics to rural health status. We feel like that's the only way that our clinics can be financially viable for the long term. So we will get, instead of that fee for service and a percentage of charges, we'll get an all-inclusive rate, which generally is a little bit higher for the patients that are not as complex, but may not quite cover the patients that are complex. So it's kind of a wash. But the nice part is it's always a standard amount, always the same amount. It's easier for us to financially survive that way.
I think it's a struggle here. I mean, Medicare and Medicaid being so high for our hospital, people can't afford commercial payer, and Blue Cross is the only one on the exchange right now for our county. So it makes it really tough.
We will measure success by how few people are admitted to the hospital. The overall goal is truly to create a healthy community. My wish list around that is certainly there's changes at the political level that begin to reimburse us for care coordination, for population health management, for integration of behavioral health. That will be very successful in all communities, including the metro areas. And I think if we can get the appropriate reimbursement and we're able to implement those things, we will see cost come down nationwide. That's my big wish list, is that we can have some payment reform that will allow us to continue to invest in our community and invest in programs that will lead to better outcomes.
Our hospital in the state of Colorado is really unique, and we are the only hospital that has all of the services under the umbrella of the hospital that we have. So we have assisted living, we have a nursing home type element, we have an ambulance service, our 911 service is all funded under the hospital. And so that's kind of unique even to the other people in our same county who kind of break some of those services apart in the taxes and levies that they get.
The alternatives, if we're not here doing these things, you drive to Vernal. Not having a pharmacy in town, that matters. Not having a clinic in town, that'd be 6,000 trips out of town every year to go see a doctor somewhere else.
If we keep things the way they are, and I'm going to get into what it would mean for payroll cuts to balance this in a second, but we run out of cash about January of next year. And once you get to this 2 million mark, losing a couple of doctors or some kind of roof unit gone out with air conditioning, some life safety code that we have to address, it gets very risky. We have 28 people that live here, and you get down to where you start missing payroll or you don't, I want nothing to do to that.
If the town votes for no, then just gotta have to be at peace with the fact that what Bailey said, what our cost report preparer says, you focus your cost on the places that pay, and that's the critical access hospital. But our critical access hospital is a small piece of what we do. I mean, sure, we need an ER, but if you have a heart attack or roll a four-wheeler or something like that, you don't want to have somebody coming from Vernal to get you to take you there. But at 3 patients a day, the reality is what people use here is the 26,000 prescriptions a year in the clinic, or the retail pharmacy, the 6,000 visits in the clinic. The people that live here, the 14 in assisted living, the 14 in long-term care, the outpatient labs and x-rays we do for people that have managed whatever disease process they're managing, or just, routine checkups. And those are the things that are going to go away.
Most of you know that I am pretty adamantly opposed to this huge mill levy increase. But I want everybody to know, as I've spoken to everybody and told you, I want this hospital to succeed. I've lived here with my family for a long time. This is home to me. I have roots here. I have built a home. This is where we plan on retiring. But, and also I would like to say, is I've been well satisfied with the medical care that I've received here. But what you guys are wanting to do with this mill levy increase, I just don't think it's going to pass. I have suggested a few of the options would be, number one, I know this isn't popular, but a 5% pay cut across the board, except for upper management, which I think should be 10%, because I believe some of the management decisions have created the problems that we have today. Another thing, instead of asking the voters for 14 mills additional, ask them for 8 mills. I'm not guaranteeing that this will help, but if you could show the public that you are willing to accept part of the pain and not put everything on the taxpayers' back, I think it'll give you a whole lot better chance of passing this.
And I hear what Frank's saying, and I see the frustration in a lot of the people that have come to me with complaints over the last several years. Their deductibles went from almost non-existent when I moved to town in 2008 to our average deductible is now $4,000 that we see in this hospital. And people are paying out of pocket, and it's expensive. The cost of employees is a lot more expensive than people realize. And whereas Frank says we're on the high end, we're on the low end across a lot of almost everything here. But a 25% pay cut would mean I don't believe we'll be able to get doctors or nurses. I mean, we'd be starting nurses at $18 an hour. There's nowhere I've seen that does that. And I believe that the public has a right to say if they want to have this. I think Frank's right. I'm scared to death it's not going to pass. Every day I read about hospitals in towns the size of us or even a little bigger. There's been 100 of them. And that doesn't include the ones that have been bought up by bigger entities.
You're not going to get the employees you have right now. If you cut our wages and we leave, I can make the same amount of money and more in Texas and just do direct labor. I don't have to work ER. I don't have to take calls. I don't have to do mammals. I don't have to do CT and X-ray. I could do one job. I do all of those jobs. I'm a working manager. I understand what you're saying, but I don't think you understand the wages. We really are competitive, but I'm competitive with the CT tech at down in St. Mary's. And that's all they do is CT. I don't do just CT.
I don't want my taxes increased. No, right? I mean, nobody wants that. It's not something that everybody is excited about. Nobody is. But what it comes with, the cost of this increase, is a life or death, really, for a lot of people in this community. So if we don't pass this, something that's important and is in root here in this building and in this community is going to die and take a lot with it.
But from the bottom of my heart, I believe if we don't pass this, I believe the town is going to suffer. Because I think towns without health care shrivel up and go away. And I'm not trying to be, in a way, thank you for bringing this, because it brought it to the point where we could have these kind of frank discussions. I think we go and we give the taxpayers We try to be honest with them. I don't want to sensationalize it, but we give the taxpayers a choice because it's up to them. Everybody has a vote and we see where the chips fall. But I do think Frank's right. I think this is going to be very tough.